Sorry to interrupt, but first, I would like to tell you a short story of a 28-year-old lady named Jasmine. Jasmine had always been active. She loved hiking with her friends, biking through the city, and dancing on weekends. But lately, something had changed. A few minutes into her usual run, her chest would tighten. She'd start coughing, and no matter how deeply she tried to breathe, it felt like she wasn't getting enough air. Maybe I'm just out of shape, she told herself. I've been busy with work. Probably nothing. Still, the shortness of breath kept getting worse. One night, after climbing just one flight of stairs to her apartment, she had to sit on the floor, gasping. Okay, this isn't normal, she muttered. The next day, Jasmine scheduled a visit with her primary care doctor. She described what had been happening, the wheezing, the tight chest, and how she sometimes felt like she was breathing through a straw. Her doctor listened carefully and then asked a few more questions. Do these symptoms get worse with exercise or at night? Jasmine nodded. Yeah, both, actually. After a lung function test called spirometry and a physical exam, the doctor leaned back in her chair. Jasmine, it sounds like you have asthma. It's not uncommon for adults to be diagnosed later in life, especially if the symptoms start gradually. Jasmine blinked. Asthma? I thought that was something kids usually had. It can affect anyone, the doctor explained. Sometimes it doesn't show up until adulthood, or it can be mild for years before becoming noticeable. The good news is, it's very manageable with medication and a few lifestyle adjustments. She prescribed Jasmine an inhaler and explained how to use it.
So what is asthma? Asthma is a chronic respiratory condition that affects the airways in the lungs, leading to symptoms such as wheezing, coughing, chest tightness, and shortness of breath. It is characterized by inflammation and narrowing of the airways, which makes breathing difficult. Unlike acute respiratory conditions, asthma is long-term and often requires continuous management. While asthma can be controlled with medication and lifestyle adjustments, it currently has no cure. The primary difference between an individual with asthma and someone without the condition lies in how their airways respond to various stimuli. In a non-asthmatic person, the airways remain open and relaxed, allowing air to move in and out of the lungs freely. However, in an asthmatic person, the same airways are hyper-responsive and may constrict when exposed to triggers such as allergens, cold air, exercise, or pollutants. This constriction is often accompanied by excessive mucus production, further obstructing airflow. Asthma is one of the most common non-communicable diseases globally. According to the World Health Organization, also known as WHO, approximately 262 million people were affected by asthma in 2019, and the condition caused an estimated 455,000 deaths that year. While it affects individuals of all ages, asthma is more prevalent in children, and its severity can range from mild to life-threatening. Asthma prevalence varies significantly across countries, largely due to differences in healthcare systems, environmental conditions, and genetic predispositions. Research shows that high-income countries often report higher prevalence rates. For instance, Australia has one of the highest rates of asthma in the world, with about 11% of its population diagnosed with the condition, Australian Institute of Health and Welfare, 2023. Other countries with high prevalence include the United Kingdom, New Zealand, and the United States. These variations may be influenced by better diagnostic tools in high-income nations or by actual environmental and lifestyle differences. Identifying the key risk factors are critical for managing and preventing this chronic condition, which could be genetics, environmental exposure, air pollution, respiratory infections, lifestyle factors, or any occupational hazards. Diagnosing asthma involves a combination of clinical evaluation, medical history, and lung function testing. A physician typically begins by assessing symptoms, such as recurrent wheezing or coughing, particularly at night or after exercise, and identifying potential triggers like allergens or respiratory infections. Lung function tests include spirometry and peak flow monitoring. Let's look at some of the common myths about asthma. Myth number 1. Asthma is only a childhood disease. Fact: while asthma often begins in childhood, it can develop at any age. Adults can also experience new-onset asthma, and adult asthma is often more persistent. Myth number 2. People with asthma shouldn't exercise. Fact. With proper management, people with asthma can and should exercise. Physical activity improves lung health and overall fitness. Some Olympic athletes have asthma. Myth number 3. Asthma medications are addictive. Fact. Asthma medications, including inhaled corticosteroids and bronchodilators, are not addictive. They are essential for managing inflammation and symptoms. Myth number 4. You can outgrow asthma. Fact. Symptoms may diminish during adolescence or adulthood, but asthma does not go away. It can return later, especially if triggered by illness or allergens. Myth number 5. Asthma is contagious. Fact. Asthma is not an infectious disease. It is caused by genetic and environmental factors, not by bacteria or viruses. So it cannot spread to other people around you. Myth number 6. If you're not wheezing, it's not asthma. Fact. Not everyone with asthma wheezes. Other symptoms include coughing, especially at night, chest tightness, and shortness of breath. Myth number 7. Asthma is a psychological or emotional disorder. Fact. Asthma is a physical, biological condition involving airway inflammation. While stress can trigger symptoms, it does not cause asthma. Myth number 8. Inhalers should only be used during an asthma attack. Fact. Preventive, controller, inhalers must be used daily, even when no symptoms are present, to reduce chronic inflammation and prevent attacks. Myth number 9. Asthma isn't serious. Fact. Asthma can be life-threatening if not properly managed. Severe asthma attacks can lead to hospitalization or death due to lack of oxygen supply to the vital organs. Myth number 10. Moving to a different climate will cure asthma. Fact. Environmental changes might reduce exposure to certain triggers, but asthma cannot be cured by relocating. Symptoms can return or be triggered by new environmental factors.
It had been exactly a year since Jasmine sat in that exam room, wide-eyed and breathless, hearing the word asthma for the first time. Now, she stood at the starting line of a local 10K charity run, bouncing on her toes, inhaler tucked securely in the pocket of her running belt. The morning sun was warm on her shoulders, and the cool breeze in the air felt invigorating, not threatening, not tight, not wheezy. Just clean. She smiled. A lot had changed in 12 months. At first, managing her asthma felt overwhelming. She had to learn the difference between a rescue inhaler and a controller. She had to pay attention to pollen counts, track her symptoms, and carry medication wherever she went. But with time, it became second nature. Jasmine started seeing a respiratory therapist who helped her adjust her breathing during exercise. She also discovered triggers she'd never noticed before, like cleaning sprays and heavily scented candles, and gradually eliminated them from her home. With her doctor's guidance, she created an asthma action plan, a simple chart she kept on her fridge that told her exactly what to do if symptoms flared up. But truthfully, flares had become rare. Her daily controller inhaler had kept her symptoms stable. She still carried her rescue inhaler, out of habit and preparedness, but it was mostly unused. She hadn't had a single visit or major episode in months. She was running regularly again, and even picked up yoga to help with breathing and mindfulness. Most importantly, she no longer lived in fear of her own body.
To conclude, asthma is a manageable but complex condition that requires accurate diagnosis, consistent treatment, and public awareness to dispel common myths. Understanding how asthma is diagnosed and treated, and challenging misinformation, empowers patients to take control of their health and live fully. With appropriate care, most people with asthma can lead active, symptom-free lives. Share this video with your friends and do not forget to subscribe to Purple Science to get more informational videos like this.